Is your brain deficient in vitamin B8? What the heck is vitamin B8? Let's find out. Hello and welcome to another edition of the Ask Dr. Pickel show. So a few years ago, a patient of mine, before she came to see me, she had been diagnosed with depression, anxiety, obsessive compulsive disorder, and she had gone to quite a few different doctors, and they had prescribed a lot of different medications, anti-anxiety medications, antidepressants, again, quite a few different things. And every time she would take these, now some of them she said she would feel better short term, maybe for a few weeks or so, but then it would all fall apart. Anxiety would just go through the roof, or depression would become extreme, or the OCD would become extreme, and it just wouldn't control these things. In fact, she said it wasn't really even that. She goes, it was also all the side effects. She said it just made her not only mentally feel worse, but physically she started to have problems, and even her blood work looked worse for certain markers as she was taking these things. And she goes, I just can't do this, and long term there's got to be something else, which was very smart of her to say, hey, I've got to go outside the box because this isn't working for me. And so when she came to our office, we were looking for different things. We're looking for some puzzle pieces. Hey, what affects serotonin, dopamine, GABA, acetylcholine, glutamate? What affects these different neurotransmitters? Neurotransmitters are how our brain offsets emotions or deals with things. And if these neurotransmitters aren't correct, then we suffer symptoms because of that. So we had to figure out, hey, is there something affecting the manufacturing of these neurotransmitters? Is she deficient in certain vitamins and minerals? Does she have inflammation in her brain? Does she, have some other type of toxic thing, heavy metals, chemicals? Is there infectious agents? Is there something else that's affecting this in some negative way? And, we solved a lot of those issues, but still, she continued to have these, anxiety, depression, OCD, and it just was not seeming to get better. And if it did, it was, again, kind of short term and kind of at wit's end. So it's like, what do we have to do now? We've got to dig deeper. We've got to look for more puzzle pieces that could be possibilities here. And so it's time to dive into the research a little more here. So as I did that, it's looking at some different possibilities. And one of them that showed up was vitamin B8. So now vitamin B8 is also called inositol. And we can't even say vitamin B8 anymore because vitamin B8, it got kicked out of the B vitamin family because it's non-essential. Basically, we found out your body makes vitamin B8, especially in the liver. The kidneys. And so now it's called inositol. Now, here's the thing though. It's thought, okay, the body makes its own. Why would we need that? Well, if you have a chronic health issue, autoimmune condition like hers, why would you be low? Well, you're burning through it faster than you can make it, or because of other issues, you're not able to manufacture it properly. So this can lead to deficiency, which we're going to talk about more of this in kind of what I found as we go through here. And because this patient, once she started on inositol for a certain period of time, it was a game changer. So let's go through what I found and led to this. All right. Vitamin B8, one of the things it's involved with is it's a cellular messenger. It's involved with communication. So it basically helps your cells communicate, which is pretty darn important. And how do they communicate? Well, neurotransmitters is a big part of that. So it helps with these neurotransmitters. It helps to regulate cellular metabolism, energy consumption in cells. It plays a role in DNA repair. It actually does all these little things that we don't think about on a day-to-day basis and how this could affect us. But a small little thing like that could have a profound effect on everything else. So it's, one little thing can throw off the whole machine. Now, where are low levels found? Very interesting. Found low in anxiety, found low in depression, panic attacks, mood swings, OCD, even bulimia. So let's go into more of the information that supports that. Now, also, it's an integral part of the signaling of these neurotransmitters. So telling them, hey, release this one, we need this, we need that. So, if you're low in inositol, absolutely you're going to have a lot of problems. So it affects serotonin, GABA, acetylcholine, all these neurotransmitters can potentially be affected. So when I was looking through the research, one of the first studies I found was this one. And what does it say here? It says, look at that. Inositol treatment of obsessive compulsive disorder. So they basically said, hey, how does this affect people with obsessive compulsive disorder? And what is the conclusion of this is the most important part of the paper. What do these doctors, what do these researchers conclude? They said the authors conclude that inositol is effective in depression, panic disorders, obsessive compulsive disorder, and a spectrum of disorders responsive to selective serotonin reuptake inhibitors. So if a person's on an SSRI drug, would this be an amazing option for them? Wow. I mean, that is big news there. And this is out of the American Journal of Psychiatry. Now, how many psychiatrists are using inositol? Another study here. This is a double-blind controlled trial of inositol treatment of depression. This study is fantastic. And again, it's a clinical trial. So basically, they said, hey, we found that CSF levels, cerebrospinal fluid levels in most people are reported to have lower inositol levels in people who are depressed. So we're going to do this study, this double-blind study for 4 weeks. And what did they find here? Conclusions. Hey, this precursor strategy, meaning we're using inositol rather than a drug for a second messenger rather than a neurotransmitter, again, rather than a drug, inositol had a significant antidepressant effect in this study. Replication is crucial. They're saying, hey, we need to do more of these studies because this stuff is amazing. So, and in fact, the overall improvement in the scores, so they use this rating scale, it's called the Hamilton Depression Rating Scale. It was significantly greater for inositol than placebo at week number 4. And here's the neat part. No changes noted in hematology and kidney or liver function. What does that mean? No side effects. It didn't have the side effects of the drug. Wow. So another one here, myo-inositol, which that's the kind that's used in the body the most, myo-inositol, attenuates the enhancement of serotonin syndrome by lithium. So basically, when people take lithium, there are people who are prescribed lithium for many disorders, depression and other disorders. But the problem is lithium can tend to start to cause what's called serotonin syndrome, meaning serotonin can rise dangerously low and cause all kinds of problems, even potentially death. So it's not good at all. So basically, they said, hey, wait a second, we've seen some other studies where inositol has helped with issues. Let's try adding some inositol in with lithium. So these patients that were on lithium, they added in the inositol, and it basically changed the serotonin syndrome that was related to the inositol depletion, and that got rid of serotonin syndrome there. So another interesting thing. And then another one, wow. So now they're saying, hey, let's actually compare inositol to a drug called fluvoxamine. Let's see if that helps in the treatment of panic disorder. Whoa. So they did this double-blind, controlled, random order crossover study. Wow. They spent some money there, undertaking to compare the effect of inositol with that of fluvoxamine in panic disorder. In the first month, inositol reduced the number of panic attacks per week. Wow. Now they're saying, hey, because inositol is a natural compound with few known side effects, it is attractive to patients who are ambivalent about taking psychiatric medication. It's saying, hey, if you don't want to take drugs, this might be a great option. And then continuing reports of inositol's efficacy in the treatment of depression, panic disorder, and OCD should stimulate replication studies. They're like, hey, this stuff is pretty amazing. Let's study it more because it doesn't cause side effects and it actually helps people. Another one here. This is, and who knew that there's a International Journal of Eating Disorders? But there is. And they did a study. They did an effect of inositol on bulimia and binge eating. Wow. So they did this whole study, and what did they find here? What's in the discussion? Inositol is as therapeutic in patients with bulimia nervosa and binge eating as it is in patients with depression and panic disorders and obsessive compulsive disorders. Wow. They're saying this stuff is pretty darn good. And then this was also an interesting one that I threw in here. Basically, they saw, hey, in people who have liver disease caused by who knows what, the liver, when it breaks down, toxins then can move to the brain and cause what's called hepatic encephalopathy. That means now I'm getting toxins going straight to my brain, causing brain damage. So they said, hey, we kind of noticed that people who are having this problem, they're low in inositol. Could that mean something? Hey, yeah, we add inositol and that protects the blood-brain barrier. So very interesting stuff here. So if you are interested in inositol, what would you do? How would you take it? Again, don't take anything without asking your doctor. This is just what I've used with patients in my office. So as far as dosage, typically a lot of people are going to do about 1.5 to 2 grams, 1 to 2 times a day. Now, some of these studies, they actually went from 5 to 18 grams. So they went up quite a bit with this, and which really for inositol is not a lot, because the body actually makes about, is supposed to make a little over 4 grams itself per day. And then the only symptom, the only side effect when they got above maybe 15 grams or so, possibly some nausea or GI symptoms. I got a little stomach upset because of the inositol, but my depression, anxiety, and OCD is gone. Who cares? Who cares about the nausea and GI symptoms? And if it even will occur, or if it's just initial due to the change in your body. Now, where can you usually find this? In your supplements, you're usually going to look for myo-inositol. That's what it's going to be labeled as. Or sometimes it'll be a combination of myo-inositol and another one called dechiro-inositol. These are just different forms. And if it is in that form, usually you want about a 40-to-1 ratio. And so again, great stuff. I'm very impressed with inositol, and when I learned about this, then it just kind of blew me away. So I feel that inositol is something fantastic that can be used, should be used. I think more research needs to be done here on so many other different potential problems, and even further with the problems I went over. But hopefully that gave you some great information on inositol. Have a wonderful day. God bless, and I'll see you next time. And also watch this next video. I think you'll like it.